structured this is nobody has any slides. It's going to be sort of an open conversation. But they each have talking points that they've come prepared to share with you all today. And those talking points cover what specifically their organizations are doing as to respond to the opioid crisis or for public health person, the opioid epidemic. Each one of them have a portfolio of pretty exciting initiatives that they've been working on, some newer, some have been in the market for a while. So they'll start and they'll spend 5 to 8 minutes just kind of giving you an overview of what their organization is doing right now in this moment. And then we're going to go into more of a free flow where we have speakers responding to each other. That's going to leave 15 to 20 minutes at the end of this presentation for questions and answers from you. So we wanted to make sure that we have some pretty distinguished speakers up here from pretty distinguished organizations. And I know you all would like to pepper them with a range of questions. So let's get started. First of all, my name's Joe Smyser. I'm the CEO of the Public Good Projects. We're one of the conference organizers. Public Good Projects, or PGP, is just a public health nonprofit. We do large-scale behavior change programs. We do a lot of technical assistance with federal and state government as well as private industry. But let's get to the more interesting folks up here. So in no particular order, we have Gary Mendell, who's the CEO of Shatterproof. Shatterproof is really the nonprofit that's kind of leading the nonprofit sector's response to the opioid crisis, very heavily involved. We have Devlin, who's the chairman of U.S. government practice for WPP. WPP, for the public health people in the room, is the largest communications company in the world. We have Sondra, who's the director of digital marketing for the White House Executive Office of the President. We have Avra Siegel, who U.S. Public Policy Programs, the head of that group at Facebook. And we have Lauren Culbertson, who's the manager of public policy at Twitter. And if we could start from me and go to our right. So Jeff, we'll begin with you.
Sure.
And just an overview of what WP is doing right now at this moment.
Sure. Thank you. Yes, my name is Jeff Devlin. I'm chairman of government practice for WPP. And as Joe said, we're the world's largest communications and marketing company. And I just want to salute the team here for having the Surgeon General be your keynote speaker this morning. I found that as a private organization, we're about 210,000 employees around the world. We have more behavioral scientists on our staff than anybody else. We are, out of all the media that's purchased in the world, we purchase more than 1/3 of it. So I just want to say that the Surgeon General is the only sort of government official that I've ever met that just embraces the private organizations to partner with government. When I walk into the CDC, I am a vendor, and I'm treated as such, and I'm not really given any sort of, and we have so much power to offer the government. This is fully a philanthropic effort for citizenship and to show our clients around the world that we have that corporate structure that actually embraces this sort of commitment. So congratulations for that. We created, I was in Governor Kasich's office last year, and he was in a pissy mood. I'm just old enough to say that. I was asking him what his problem was, and he said that his chief of staff's daughter had just passed away from opioid, 15 years old. And he turned to me and he said, "Why aren't you the largest communications company, doing something about this?" And I thought about it, and we came back and we agreed that we definitely should do something. And we teamed up with iHeartMedia, which actually the Surgeon General embraced in a big way. And we basically, NOAC stands for National Opioid Action Coalition, and we created a few programs to sort of embrace pop culture and our media cloud. Again, the ability to pressure our media partners to donate public service announcements and time and efforts. We are Google's largest client. We are Facebook's largest client. And my purpose here today is to let you know that we wish to work with all of the 15 health agencies that this country has, and anything in the way of data analytics or whatever we can provide, we're here for you. I went to one of our behavioral scientists, and I told him about who we're talking with today, and he said that our biggest problems are a direct connect to the people we want to reach, very much like the discussions we heard this morning about targeting our audience. He said often search optimization that the Surgeon General talked about is a big factor, and when somebody has an issue and they want to get to the right people, the connections, it's a maze to get there. And he talked about connectivity and how that seems to be the biggest issue that we face in the public health area. So together, we hope to work on this epidemic in any exciting ways that we can. We offer our thanks, and we're open to share our resources in any way that we can. So thank you.
Good afternoon, everyone. My name is Gary Mendell, and from Shatterproof. My background's a little different than most of you. My career was not in public health or communications. It was in private equity and running businesses. And but I have lived experience with this topic with my older son, Brian, who struggled with addiction, mostly to opioids, for 8 years. And we went in and out of 8 different treatment programs for those 8 years, and tragically lost him the fall of 2011. And from that, when I was able to step back from it, what I saw was this huge issue in our country, but most importantly what I saw was this body of knowledge that had been developed by tens of billions of dollars of research sitting in peer-reviewed medical journals and not really being used in our healthcare system nor our communities. And so even though the issue was so large, there were solutions sitting right in front of us just not being implemented. So with that, I left my career in business and spent a couple of years building a business plan we launched about 5 years ago. Programmatically related to this issue, a few years ago we developed a plan to really focus on the treatment system in the United States. We'd like to do prevention also, and we do a little bit there, but it's mostly, most of our work is embodied in the business plan we put around really disrupting and significantly improving treatment in the United States for substance use disorder, which obviously includes opioids. It was a 5-point business plan. The first was developing one national standard of care for the treatment of addiction, which has existed with the American Society of Addiction Medicine, but it was so complex, it's really, there's no system in place in our country to measure it and put a quality measurement system around it. So we simplified it with 8 principles of care that we actually took out of the Surgeon General's report in 2016, which we believe were the most impactful to patient health, and gained consensus originally with 16 of the largest health insurers in the United States, now 21, representing most of the market, 250 million lives. And once we had consensus on that national standard of care, then we had 4 other work streams around that to get implemented. The first was a quality metric system. No different than if you go to CMS Hospital Compare or Leapfrog to find a hospital, or a consumer guide to anything you want to buy, whether it's a car or anything, a quality metric system to really do 2 things. Number 1, provide the information to treatment programs so they can learn from each other. But number 2, to use market forces through empowering consumers with the information they need to make the right choices, empowering state regulators or licensors with the information they need to decide who to license, and empowering payers to decide who should be in their networks. So point number 1, the national standard of care. Point number 2, a quality metric system. And that's been funded, and we're building it now with piloting in 5 states, or are piloting in 5 states. Number 2, payment reform. Number 3 of the plan, the 5-point plan, is payment reform. There's no way that you can ask treatment programs to do the right things if they're getting paid too little to do the right things and too much to do the wrong things. And we do that with so much of the way we pay for addiction treatment in this country. So we have a public policy team that is active in about a dozen states this year, changing the way that we pay for treatment. And next year we'll be in 25 states with some funding we just received. Point number 4 is adding capacity to the treatment system. As we educate consumers about treatment that works, we're going to have increased demand, and our capacity in our system won't handle it right now. So again, we're in many states right now also trying to change policies that will add to the capacity of the treatment system. And the last point, point number 5 of our business plan, is really the piece that is maybe often talked about but very little done about, or done in little ways. It's the stigma of addiction. Because of the stigma, consumers, approximately 20% of those addicted, have reported the reason they don't seek treatment is because they don't want their friends, their family, or their coworkers to find out. Because of the stigma of addiction, most primary care doctors won't want to treat someone who's addicted. They don't want them in their waiting room. They think it's their fault, so why should they be treated anyway? They don't know what to do if they develop a problem because they haven't been trained in medical school. They haven't been trained in medical school because of the stigma of addiction. And I can talk on and on and on about the stigma. So on that last point, we've recently formed a relationship with McKinsey & Company and Public Good Projects to develop a national framework. So organizations like ours and all of you fit into it. There's no way that we're going to tackle this all on our own, but what we can do on our own is develop a framework that any organization that wants to participate can fit in and do things that are evidence-based, that all fit into a comprehensive plan. We're all working together, not haphazardly. We're running campaigns here and there like us. We run a campaign, that's not really moving the thing. Campaigns on their own don't. We're all working together in a comprehensive framework. We can. So that's our plan, and look forward to speaking to you all a little more.
Well, thank you so much for having me today. I'm really honored to be on such a distinguished panel, truly, and also to have worked with many of you, so I'm really grateful for that. I'm Aubrey Siegel. I head up U.S. policy programs, public policy programs at Facebook. And this is an issue when we look at which policy areas we want to engage in. We look at what is affecting broad swaths of the American population. This is, as Joe said, as you all know, as public health professionals, an epidemic. And it's an issue that is affecting families and communities across our country. And it's a place where we've seen individuals use Facebook organically as a venue and a forum for support, for help for themselves or their loved ones. And so our strategy has really looked at how do we lift up the ways that people are already using Facebook to find support and connection on this issue, and also obviously how do we protect against the bad actors trying to use our platform for bad means. So we have a very robust security and safety effort around this issue on our platform. But on the good, what we've done have looked at organically how are people using Facebook, and then we've consulted with experts like Gary, like Joe, like others in this room about to better understand the crisis, to better understand what would be effective and resonant, and after doing that analysis, what are we uniquely positioned to work on? How can we add to this? Because it's clear, and we've already heard that so far from Jeff and Gary, that this is all hands on deck. And this is something that everybody has a role to play, and no one's going to solve this alone. No one sector, like any big crisis, no one sector is going to solve this alone. And it's why we want to play our role in addressing the crisis. It's why Lauren and Twitter and Facebook and Google and CSIP have come together to form a coalition around how tech can be leveraged for good in this space and how we can collaborate. So we've really centered our work around a couple, or really 3 buckets. The first is connecting people to resources and help. We've seen the ways that people are organically using Facebook to find that help, even using some of our products and tools like Messenger for finding crisis support, using Facebook Messenger as a means for reaching those in need. We've looked at how do we raise awareness and public education around this issue, and I'll come back to that point in a second, but whether it's partnering with the Ad Council and the Truth Campaign in the White House around the prevention efforts around the epidemic, or we've partnered with Gary and Shatterproof on some of the campaigns they've run to lift up voices and break down stigma. And then the third bucket we've seen is Facebook groups and online communities have become, again, organically a very powerful tool for people finding help for their own recovery or the recovery of a loved one. So we've seen hundreds of groups pop up on Facebook where people are using those online forums for support. And so we've partnered with organizations and groups in those spaces to help lift up that work. On the second piece, since I know this panel I think is supposed to focus on stigma, I'll talk a little bit about our most recent effort, which we're really excited about, which is a national public awareness campaign to break down the stigma and shame associated with addiction. So a couple weeks ago, we launched a campaign in partnership with the Partnership for Drug-Free Kids and the Center on Addiction, which is a newly merged organization, to lift up the stories of individuals across America who have suffered their own struggles with addiction, or who have a loved one who has suffered, and to really show and paint a picture of how addiction touches every corner of this country, no matter who you are or where you're from. This is not an issue that you're facing alone, and this is not an issue siloed to one demographic and one group of people. And so we're running this campaign across Facebook and Instagram, lifting up these stories. I think we actually have a video, but I don't know if it's teed up to go. Okay, I can show it to you and then talk a little bit more about it. Just if we do have it, is that a thing? If not, it's not a big deal. Go to stopopioidsilence.org.
Is it on there? Is it on Stop Opioid?
It is. So what the campaign is comprised of is we worked with a documentary filmmaker to film 12, oh yeah, you could just go to it. That would be easy too. To film 12 different stories, and then we're running, okay, so.
Is this the one?
This probably is. The 60-second, yeah, it should be, if it's working right. If it goes longer than 60, we'll come
Nick was a high school football player.
No,
He was the greatest son he could possibly.
There should be it's, you know, I was just gonna give you guys a flavor while I'm talking about it. There should be a 60-second one that's up there, but, you know, if you go down, if you click through what you were just doing on that arrow.
I think you're okay.
Yeah, let me show you what kind of stories.
We have a Google representative.
I mean, I should know these. It's okay. We don't need to waste time with that. But basically, we documented stories of 12 different people. There's about 3-minute stories of each individual person, and then we did some mashups that are running in the form of ads and that do our compilation of these stories. And then if you want to learn more, you get led to this website to learn more. We also have a portion of the campaign to our first prong that I talked about of the work we do, which is to connect people with resources. We worked with the Partnership for Drug-Free Kids and Center on Addiction to create an automated messenger experience. And so part of the campaign ads we're running will also lead you directly to Messenger, or if you go to the top of stopopioidsilence.org, it says message for help. And you'll have an automated messaging experience. It will ask you about, you know, who you're looking for help for, yourself or a loved one. It'll ask you if where you live, and it will take that information and it will feed back to you resources in your area, in your state, and then also if you're a family member looking for help, the Partnership for Drug-Free Kids has a crisis hotline with trained social workers that are there to speak on the phone, and we'll also link you with those folks. So we wanted to try to lift up the awareness, because we know that this is affecting 1 in 2 families, over 1 in 2 families in America, but also, according to the Surgeon General, only a quarter of people are getting the treatment that they need, and to Gary's point, so much of that is because of stigma. And so our goal here was really to send that message that this is everywhere and this is everyone. And we also finally worked with senators from 10 of the hardest hit states to do specific public service announcements in their states. Actually, after some research we did with Joe in the Public Good Project around messaging, looking at the ways that people are receiving messaging about the crisis, we saw that interestingly enough, authority figures were actually very good messengers for communication on this, and makes sense, right? Who are people seeing on the front lines? They're seeing police chiefs, they're seeing emergency health workers, EMTs. They're seeing those folks in their communities, and so actually authority figures happen to be good messengers. So we worked with 17 senators to send out state-specific messages so that we could try to reach people in some of those hardest hit areas. Happy to answer more questions about that, but that's sort of the top line.
Great. Hi, I'm Lauren Culbertson with Twitter Public Policy. I'm really delighted to be here with you all today, and I enjoyed the presentations before this, a lot of Twitter talk. Thanks, Susanna. And so, as Avra mentioned, this is something that we've really dove into because this is something that is affecting so many people, including my family and a lot of the other people who work at tech companies who are working to address this. So I've been leading our efforts on the opioid crisis at Twitter, and this all started almost 2 years ago. We were asked by the White House to come with a group of tech companies. They said, hey, you guys have these powerful platforms. This is a big issue. This is going to be a major platform of the administration. Would you come in and talk to us about how we can work together? We said, absolutely. We're in. And walking into the meeting, admittedly, I knew this was something that was an issue because it does affect my family, but I didn't really understand how we could be helpful. And so once we started having these conversations and these meetings, I started meeting all kinds of wonderful people who are working so hard to address this from different NGOs and government partners. And I ended up meeting a guy, and I met him at the FDA. His name is Justin Luke Riley. Justin runs Young People in Recovery, which is a national organization of chapters around the country supporting young people in recovery and their unique individual needs. And he introduced me to a guy named Robert Ashford, who's also a person in recovery. He's a recovery scientist at the University of Pennsylvania. And so we kind of started this informal coalition working group, and we kept talking and talking and talking. And one day I just happened to ask them, I said, how did you guys meet anyways? One of you's in Pennsylvania, one's in Colorado. And they said, funny enough, Lauren, we met through a hashtag online. And so that was my aha moment where I said, oh, wait a minute, this is where Twitter can help with this. So to your point, Jeff, about connectivity being so key in addressing this crisis, and I think Susanna hit on this as well, that's where Twitter, that's our superpower here, and we want to help flex that in this crisis. And so we've been doing a lot of different things to help. First and foremost, we realized we've got to be good on the enforcement. So we've upped our efforts there significantly, and we feel really good about where that is. We've partnered with DEA on Take Back Day. We provided a custom emoji and worked with our partners to amplify that message. And thanks to the White House, actually the First Lady's tweet went completely viral. It was great. We've also partnered, as I mentioned, with academics, researchers, NGOs. We've provided ads for good credits to help them amplify their message. We've had the Surgeon General at our office to talk about the opioid crisis and stigma, and members of Congress. But back to that, Twitter is all about connecting people. What I've found through this work is that there are 23 million Americans who are in recovery, and thanks to some great research from our friends over at Harvard, we know that 2.5 million Americans are utilizing online tools to aid in a big way in their recovery. This is from a guy named Brendan Bergman. He's awesome. And so we're really working hard to try to support these 2.5 million. Hopefully we have more folks who are utilizing this. So we really leaned in a lot to the recovery space because we feel like that's where we can be really powerful. And so to that end, Recovery Month is in September, and it's our vision to elevate Recovery Month to national importance because for so many people, recovery is the point of hope in this crisis. And it's the people in recovery who are also working so hard on the ground to help people get that treatment and to get to recovery. And so we want to put our arms around them and help them as much as we can. So I'll leave it there, but thank you so much for having me here today, and I look forward to the conversation.
So my name is Sondra Clark. I'm very excited to be here today with all of you. So I work at the White House, and my background's in advertising. So I loved your chart earlier where you had government officials over there. My job is to try to take those government officials and move them to another box. So I came in with sort of the technical expertise and got thrown into the opioid space, which has been an eye-opening experience for the last 2 years. And you guys all do such incredible, incredible work. So as you probably know, the Trump administration has sort of 3 goals with the opioid crisis. One of them is cutting supply, one of them is reducing demand, and then helping Americans get into recovery. So within that reducing demand and within that helping Americans get into recovery, there's lots of public awareness that has to happen within that. So we have done, and we realize that we cannot do it alone. We have brought in a lot of groups to the White House to work on things, and we've really, really leaned on public-private partnerships to be able to do things. A lot of people in the White House right now come from the public space, and one of the things we realized is that working with the public sector can move a lot faster than the private, or moving with a private sector can move a lot faster than government. So when we were looking at our first kind of advertising campaigns, we looked at the audiences that we thought were most affected by the opioid crisis. And so the first campaign that we launched was a prevention-based campaign, and we decided to partner with the Truth Initiative and the Ad Council for that campaign. So that was a prevention-based campaign that we launched about 1.5 years ago. We knew we wanted to do extensive testing, so we tested over 150 different messages to see what would resonate with those 18 to 25-year-olds. We produced 2 different sets of ads, and then relied on donated media from a lot of our partners. All across, we had about 20 different partners who donated either media, in-kind donations, or monetary donations to be able to pull off this ad campaign. So we were really excited about it. It got launched, and it's been out in the market for about 1.5 years. The first set of ads were, again, prevention, showing teens kind of how quickly addiction can happen and how far you can go for addiction. And then the second set of ads showed what treatment actually looks like, to show sort of the end line of if you misuse or abuse opioids, here's what happens. And we actually did a real life filming of a young woman named Rebecca. She was 26 years old. She got addicted to opioids after having a knee surgery because of dancing. And she became an IV heroin user, and she let us film her for 3 days going through an MAT treatment. We were very cautious and made sure to have people on site and nurses and all those boxes. But she let us film that for 3 days. And it was a really, really incredible ad. I would encourage you all to watch it. And that's really moved the needle on a lot of things. I am a big proponent that we don't use vanity metrics, but we are about 2 months out from having real behavioral metrics. So I'll just share a few of those. So with this partnership of these 20 different groups, we had about 95 million video views on all these ads, 3.25 million social engagements, and the exciting number for me that's a good indicator of behavioral and attitudinal change is that 58% of young adults within that longitudinal demographic said they had awareness of the ads. So we're about 2 months out from having sort of the real meaty things to show those attitudinal differences, but really promising early indicators on those ads. So that was a very exciting campaign that we got to launch and couldn't do without a lot of private sector support. The other campaign that we're working on that launched about last week is Crisis Next Door. And this was a campaign that we launched organically and then saw a whole bunch of success because of it. I love what you were talking about of sharing stories, and this is a stigma-based campaign. So this is a user-generated, people are sharing their stories into a website that we have. I get to watch them every Tuesday morning as I'm approving them and vetting them, and they are incredible. I have to take a walk after watching the videos because they're just so impactful, these people sharing their stories. And then we use those to take them and target them to people who are similar to them. And this campaign has 2 major goals. Number 1 is showing that addiction is a disease and it needs to be treated as such. So we have a lot of people who talk about going to treatment numerous times, and they talk about how, maybe this inpatient wasn't the right one, but this MAT was, and they talk you through that story and show that addiction is a disease and it needs to be treated as such. And then the second one is addiction can happen to anyone, hence the Crisis Next Door. And so we have incredible stories that some women look like soccer moms, you have others who have tattoos on their face, just showing the wide swath of people who have been addicted by substance abuse disorder. So we've been, and then part of our other goal is to look across the government and what are the other advertising campaigns that are happening that can kind of be optimized or fixed. We've realized that DC definitely is a swamp. And you were talking about sort of the blast marketing or the blast things. We don't want to be doing that. We want to be thinking through audience first and what is the best message that reaches that audience. The anecdote that I will leave you with is when we were showing a new set of ads to the president, he turned to Kellyanne and he said, "I haven't seen any of these ads. Why haven't I seen them?" And she goes, "Well, sir, you're not a 17-year-old girl, so you haven't seen these ads." So we want to make sure that we're being very specific to get the right message to the right people at the right time and on the right platform. And you know, as we are looking at these different audiences and these different campaigns, we have a couple more in the works that would love to share with you in the future. We really want to make sure that we are measuring the right things, that we are reaching the right audiences, and that we are being the best steward of the government, the taxpayer dollars, to reach an outcome. So, thank you.
Thank you very much. And for all of us in the room, we can see here that there's a ton of work being done by all of your organizations every day. I'm curious because we have several sectors represented in the room, and I know that as a public health guy myself, I know what the public health people are probably interested in hearing about, and then I have a sense of what the industry people are interested in hearing about. I'm curious if you each are in a unique position in that you're in a role that has some authority and some perspective across a whole bunch of different silos. You're here representing your organization that's doing a lot of work around the opioid crisis. If looking from the outside in at sectors that your organization is not a part of, where do you see opportunities for increased effectiveness or efficiency? So if you're here representing an organization that is from private industry, you have a career and experience in private industry, looking out over the public sector, I think those of us who are from the public sector are curious, you know, especially in relation to the opioid crisis, what does industry think that we could be doing better? What we want to hear from you. Where are you seeing missed opportunities or areas where we could be more effective or more efficient? And then I think for those of you in the public sector, equally so, if you could share with us a couple ideas or nuggets of insight, looking at your peers in the public sector, what are some things that industry, in your opinion, has sort of figured out or is doing a little bit more effectively, perhaps, that you would put in front of somebody from the public sector, a different way of thinking about this kind of work? So Jeff, if we could start with you.
Sure. Opioids is it's like boiling the ocean. There's so many parts to it, and you know everybody has to take a little slice of that and figure out how they can help. And in doing so, whatever you have to offer and you raise your hand, it's going to help. One of the things that we're doing and talking about authority figures is we are, along with our partner iHeartMedia, we are offering a free hour to every governor to talk to his constituencies about the opioid epidemic and how to curb it and what are his programs or her programs. So, you know, you basically, you know, sort of raise your hand and you help out any way you can. I think the Surgeon General said it best. It's better health through better partnerships, and I think that's where I think government can really embrace private enterprises to help with the epidemic in many, many ways. So those are my thoughts.
If we just go down the line here, or your thoughts?
The gap that I see, what we're trying to fill now is there is so much good work done all over the country by so many organizations. And I mean, I've just met such wonderful people and wonderful organizations since I've been doing this for the last 5 years. The gap that I see is the coordination of it to make sure that it's all done comprehensively. And so what we're trying to do now is we're just beginning to do this, is a landscape analysis of what's the total picture of what needs to be done, who's doing what great work, and we don't need to create any new dots, but could we see where the dots are missing and fill in those gaps?
Yeah, I was gonna say something very similar. Having been in the public sector for most of my career and then going into the private sector, I've seen how a lot of different movements have evolved, how around different crises and issues. And I think, the problem with addiction is that it's always lived outside the traditional medical system, and it's not been seen as a disease until very recently even recognized by government as such, and until the last, couple administrations. And I think, so it started behind, right? And so it's not been in the mainstream, and so it hasn't had that credibility that it needed to get the investment from the private sector in the same way that other issues have, like breast cancer or, domestic violence or other issues like that. And because of that, it's been so bifurcated, there's been a lack of coordination and centralization of strategy. And so I too, like I mentioned, I've met so many amazing people doing so much amazing work on the ground in the states, but there's not a coordinating body to that at all. There is no, American Public Health Association for addiction that has really been able to corral everyone and bring them together. So that's so exciting to hear, Gary, that that's something that you guys are helping to take on in your mission, because coming into the space, not having worked in a lot of different public health arenas, but not addiction, when I first came in, I was like, all right, give me the lay of the land. I'm like, who are the experts? Who do I need to learn this thing? And it was just like, whoa, this is all over, and there's not, and I think also what happens is there's competition because there's not a lot of funding, and so, the incentives, I'll stay in my lane, but like the incentives to working together are also, there's disincentives, right? And so I won't get into the funding thing, but, because there's a lack of funding, because there's a lack of centralized strategy, I also think it makes it harder for groups to work together.
I'll just add one point to that, though, is that I completely agree with the issues of competition for funding, but the beauty of it is if we just understand what each other is doing
Totally.
and don't duplicate,
Exactly.
fill the gaps,
Yes.
it can work out beautifully.
Totally.
I mean, you mentioned partnership and Center Addiction, great organization,
Yeah.
doing great things.
Totally different things
I just want to make sure
coming together.
I understand what they're doing.
Yeah.
Don't duplicate it.
Yeah.
Let them own what they're doing it really well.
Yeah.
And there's dozens of other organizations, and we can fill those gaps. There's enough people that care about this.
There's enough work to be done.
Absolutely. Right.
One gap that, and maybe it's not even a gap, I think it's more of an opportunity, is that, here's a great example. I'll give our friends over at Google a shout out. So DEA's had, different maps of drop-off locations. Love DEA, they're great. They gave Google some of their data to build out a map utilizing Google Maps. So that way it's mobile friendly. It's more user friendly. People are more likely to use it. And so I think that's a great case study of how government has all of this great data. Tech companies have some of these tools. So how do you put these things together? One thing Justin, who I was talking about from Young People in Recovery, he talks about this all the time. He calls it, how do we Uberize recovery? And in terms of how do you take, what tools are available and package them and make them accessible, and package them in a way that especially young people can easily access, and it's user-friendly for them.
Can I just add one quick thing to that? I don't know if anyone's here from the Baltimore Department of Public Health, but I know, for example, because it can be really laborious to try to track the data and then figure out how to get it to people's hands. So I know, for example, the Department of Health in Baltimore was trying to track how many open beds there were in real time at different treatment centers. And you could, working with tech or with someone to develop the right technology could really help to solve the back end of that issue.
Yeah. To go back to DEA Take Back Day, I think that's an amazing example. So DEA Take Back Day is, I think it's one of the best ways to get people involved in the opioid crisis who might be scared to engage. So there's not a lot of volunteer opportunities within the opioid crisis besides sort of the NAS baby space. You can raise money, you can do things, but for someone who's never touched it, going to your medicine cabinet and taking out your unused pills is a great way to get involved. And we've had incredible success in not to use the word synergy, but over the last couple of years of, I think Google's done a great job, Facebook has done a great job. I know we get all the governors, they love the custom emoji. Like, I don't know what it is, but magically when Twitter gives us a custom emoji, we get all the governors, all the lieutenant governors get all excited about it and tweet out about Take Back Day, which is amazing. And they start the conversation, and we get local news reporters doing it. And so I think those sort of things where we can all come together, and DEA Take Back Day it's a simple one. I know it's not incredibly moving the needle, but it's a great way to raise awareness about what you can do in your own medicine cabinet. And then to answer the original question, we love it when we see groups who are focused on one thing and do it really well. Shatterproof has an amazing call-in hotline for parents, but it's for parents. Like, you guys have peer-to-peer parents doing it, which is so incredible. And so I work with a lot of consultants who come in and try to solve these things, and they get so overwhelmed with all the aspects of the crisis, and they want to solve all of them. But I think really honing in and doing one thing really well, whether it's mother education, whether it's, doctor education to reduce prescribing rates, the great work that CMS is doing right now, whether it's, empowering nurses to talk about it, whether it's, there's tons of different ways, but I think especially when we see advertising campaigns that are funneling 5, 10, millions of taxpayer dollars into a campaign that's trying to be all things to all people, that's when we say, maybe let's take a step back and think through how we can do one thing to one audience and do it really well. So that'd be my advice to private and public.
One other area, while we have a lot of health professionals here, one thing that I see a lot on Twitter, and I get really excited about it, because I've met a lot of researchers through this work, is that they all talk to each other on Twitter, and they find each other on Twitter, and they share what they're working on, and then sometimes they collaborate as a result. So if that's something you're interested in, there's a whole research world of Twitter you can hop into.
So just building off of that last question, there's a lot of forums going on almost every day for the opioid crisis. We all know this, and I've been a participant and a speaker at many of them myself. I know a lot of us have been, and I think it can get difficult because you continue to be in these forums over and over and over again, and it feels like a circular conversation, and then nothing ever happens. We all share our email addresses, and we don't feel like anything's coming from it. Maybe I'm just speaking for myself, but one thing that I always wished people would talk about more is, DEA recently announced that we have not yet reached the peak of the opioid crisis. So those of you who are epidemiologists, you think about the epidemiological disease curve, the curve of incidence of disease, and then the death curve, the addiction and the death curve. That's a really terrifying fact that the DEA, who views itself as responsible for knowing where the drugs are coming from and where they're going, is openly saying that that we have it's not as bad as it's going to be. And so I think knowing that, I'm very interested in, a lot of the efforts that have been focusing on the opioid crisis are 2 years old. They're really fresh. And if you think of those of us in public health who work in other areas, I got my start in HIV, you think about how long it took us to wrap our heads around these other huge societal problems, challenges, enormous challenges, how long it took us to organize ourselves, all the stakeholders at the table. And in many ways, I think we're moving light speed right now. We're making mistakes, and we're learning a lot. But if you think about who's in the room in front of you, and then right after this question, we're gonna go to hear from you all. If you had one thing, knowing that we're midway through this, optimistically speaking, one thing that you would like academia, industry, and government, if you could change the world with a snap of your fingers, what would academia, industry, and government do moving forward that from your perspective would make us all respond a bit more efficiently and a bit more effectively?
I think it's a strategy, and one that you truly live by that strategy, creating sort of a path to utilize the assets of all three of those organizations and doing it effectively.
So more coordination.
Yes.
Everyone, all activities laddering up to one national strategy. Gary, what about you?
I think I'm going to sound like a broken record. I'm going to agree with Jeff.
Yeah, and I would say, you know, for academia, get the information out there. I know there's a lot of great research that I didn't know about, and I was able to find out just through some of this work, but I think if everyone knew about it, we'd be better off. Government, just get more organized, especially with data. I think that's really big here. And then tech, industry, for us, I know working together is, we've really worked really well together. Some people think that we're competitors, but here we're friends and we're trying to do the right thing together.
Yeah, I'll echo that, and I'll say it's been inspiring. Lauren, you mentioned this about the people we work with. Like, this obviously touches everybody, right? Whether it's opioid addiction or some other form of addiction. And so having worked on this internally, everyone is so passionate about it internally at Facebook because it's so personal. And then it has been so refreshing to work with the other tech companies. So there is so much room for collaboration. I would say, though, it's helpful to understand, like, what when we work with partners, making sure we're all aligned on what it is we can bring to the table, because we're not gonna come up with the app that's gonna Uberize addiction. That's not what Facebook is good at, right? Like, we're gonna come up with how do we raise awareness. Like, why do we do a public awareness campaign? It's because we're uniquely positioned to help raise awareness with the biggest, like, microphone in the world. So, you know, thinking when you partner, and this is a struggle, I think, whether you're on the public side or the private side, I've been on all the different sides, thinking about what the other organization, what they're uniquely positioned to do, because they're not everyone's going to solve for every single thing,
Right.
and then using those strengths to come together.
Absolutely.
Yeah, a good example of that, actually, we built out the search prompt for vaccine information. It was kind of a no-brainer. Vaccines.org existed, and that's a very good website with lots of information, and you know that's where you point people, right? We don't want to be the expert on this. We want to point people to the expert on this.
Yeah, and I think to echo what you were saying is making sure if you do something good to continue doing it, and find the right partners who are doing the good work. Again, going back to kind of public awareness things, we do see people launching curriculums or pamphlets or things that have been done other times and maybe done better. And so you might not be the right voice to speak to the audience you're trying to reach. So our example of this was, we knew the White House was not the right voice to reach 15-year-olds about opioids. Like, we weren't the right messenger for that. So we partnered with Truth Initiative, who was a trusted voice within this space because of their tobacco work, because we knew they were the right voice for it. So we realized that they were the right partner for that. And then I think, you know, we had an event a couple months ago where we brought in about 25 private sector partners who are all doing different things for the opioid crisis, which is really incredible. And I think there's been such great conversations that have happened after that meeting. And we're really looking towards the next year of what kind of using our convening power of who we can bring in to start those conversations and start those, because we want to empower everyone and not control it.
If I could just add one thing before we turn it over, which is really one of the themes of this conference. The last point of the program that we're working on is stigma reduction. We can all work on many of the components that we all are working on, but if we don't change the way people think about this disease in the different segments of people, whether it's the public, whether it's the healthcare system, the criminal justice system, or policymakers, et cetera, corporate officials, corporate America, we're only going to get halfway there. And we can work as hard as we want in all these other activities, but we need to destigmatize this disease. My son went to 8 different treatment programs, and he always felt alienated when he came home. Where his best friend, not his best friend, but one of his friends was being treated for cancer. He came home to, you know, lemonade stands on the weekend raising money for his charity, when my son came home to silence. And that's the self-stigma, the structural stigma, and all the different components. We change that, and all the work that we're doing gets accelerated. And if we don't, it's improvement. It's all good, but it won't reach its potential. And using a public health approach with continual testing of what's worked for HIV/AIDS, what's worked for marriage equality, what's worked for domestic violence, and studying those, which is what we're doing right now, and trying to see what analogs we can apply to this and what analogs we don't can apply to this, can really make a difference. Can really magnify all the great work that's being done by so many.
And I think the stigma piece is one that's exciting, because if you're duplicating efforts, it's actually better. on the stigma side. So, I think Facebook, you guys are running a similar campaign to Our Crisis Next Door, and that's exciting for me to hear that we both saw a need and are both executing on it. Because in like the voter world, you kind of, you need 7 different touch points with someone in 3 different mediums to really get a point across. And so if we are all talking about stigma in different ways, that's going to resonate with different people and hopefully get through.
Okay, well, I'd like to open it up to you all now. And do we have someone who's going to be walking around with a mic? Volunteer?
Thank you, that was a fantastic panel. My name is Sherry Pagano, and I'm an academic researcher. I do a lot of research using social media platforms, Facebook and Twitter, and Instagram. And actually, I just hosted a conference at University of Connecticut 2 weeks ago on social media and health. And one of the themes that came out in our conference is how it's become increasingly difficult to access data from your platforms, just with changes in API and so on both platforms. And so I should be clear that I need public data, as well as data that we're producing ourselves. And I'm wondering if you could sort of speak to this, or if there are any initiatives or resources coming down the pipe that would make it easier for researchers to study all of this wealth of data that is on your platforms and public.
Sure, I can take that. Yeah, I mean, it's no surprise to folks in the room that, privacy is a topic that's of very national importance right now. And we take privacy really seriously, and we have guidelines that guide how researchers can utilize our data. We have a public API, and a lot of researchers are doing a lot of great work utilizing the Twitter API, including some of the research that I mentioned earlier. But I'd be happy to, I have some resources I can send to you. And there's also, I think it's data.twitter.com if I'm not mistaken, but we do have a lot of resources that tell you what you can and can't do utilizing the data.
Similar response. Happy. I mean, it's attention, right? Like we make data too easy for people to use around sensitive health information, and we make it too hard for researchers. And so it's not easy, and we're constantly trying to find the balance of how we make sure that good work is being done with the data for good public uses and also protecting people's privacy. Happy to connect with you afterwards if you have specifics and see what more I can find out from our team depending on what you're looking for. I'm not an expert in all our data policies around public use, so I don't want to speak too much to it.
I also just wanted to put it out there that that is a challenge for us.
Yeah.
Well, first of all, I want to thank Joe Smyser for organizing this terrific panel. Thank all the panelists. And I'm really pleased that we had someone from the White House on the panel. And I wanted to follow up. You alluded to some convening that you have been doing. Given the impact of what we've been talking about with this particular crisis in America, has the White House thought about a fully throated White House conference on the issue? Are White House conferences even still part of the landscape of using the bully pulpit? But my sense is this is a limited audience, obviously, but have you thought about that?
Yeah, so, we did have, about a year and a half ago, we pulled a bunch of groups together and had about 250, many people in this room were probably there. That was right before I came on board, to bring a bunch of people in. And then we do a lot of kind of smaller group meetings or one-off meetings. That is not something we've considered recently, but we can definitely take it back. I am, again, on the public awareness communication side of it, so I can definitely take that back to the group who handles that.
Joe, my name is Bob Gold. I'm a professor at the University of Maryland. I also really enjoyed what the panel had to say, but I'd like to challenge you to think differently than you are, because we've had lots of successes in public health over the past, and the question is not how do we succeed, but how do we scale these things to a meaningful level. And also, I think we have to begin our assumptions with the fact that there's no evidence that a problem like this is going to be solved in a short term. I think we have to be willing to make a long-term commitment We need to not just look for solutions that work, but that are scalable and that remain. And the best illustration I can think of is we've dealt with stigma in so many different problems, and we've solved it so many different times. And if we actually have solved it, why is it still a problem for this issue? What makes this issue unique from all of the other issues in which stigma was an issue?
I'll take a first crack at it. Feel free to jump in. Jeff as well. I think we have to look at I have 2 points to that. Number one, if you look at the reduction in stigma that occurred with HIV/AIDS, and you looked at marriage equalities, 2 recent examples, they were 2 or 3 decades. So I don't think anybody here in this panel would disagree that it's a long-term problem. But I don't think you can go to execution partners, is what the frame we're using for it, and ask for 2-decade commitments. I think what we need to do is put realistic expectations. This is going to be a decade or 2, but I prefer to say more of a decade, and I think it can be done in a decade because those didn't have comprehensive plans when they started. They fumbled for a couple decades and they finally figured it out. I think when we start with a comprehensive plan, we can do it a lot quicker. Even a lot quicker, call it a decade. You're not going to get execution partners to sign up for anything for a decade, but you can get execution partners to sign up for a 2 or 3 year period where we have measurable goals. Everyone feels like a success as we hit those 2 and 3 year goals, and then they renew their commitments. So that's my approach. That would be a suggestion that I would have, and how I'm looking at it as far as bringing in partners for something a little bit longer term than usual people sign up for. In answer to your question about why we've struggled, I don't know. I'm still learning, so I can't say for sure, and others can chime in. I think a lot of it is I don't know that we've fully taken a public health approach and really studied the interventions that have really worked with the others. And I've learned so much just in the last couple of months as I've been reading the research and really understanding it. And one of the things that really popped out to me was what really worked with HIV/AIDS is when the country finally understood that this is treatable. And I think the messages around whose fault it is, I can't say for sure because we're still developing our plan, so we're not done yet, but in the early reads of what we're developing, we care less about whose fault it is. If someone has diabetes because they have too many donuts every day, they're still getting treated with respect and love and empathy in the current science. I think it's more about the public understanding that this is treatable at the same rates of success as any other chronic illness. That the vision in the public mind is not a junkie, they're not an addict in the back hallway or a back alley putting a needle in their arm. It's people here. There's people in this room that are probably in recovery. And when that becomes the public's opinion of what someone with this disease is, when we get rid of the stigma of medication, so that is the actual fact of how well people recover, then I think we can start to reach a tipping point. But I'm still new to this, and I'm still learning. I don't know if others want to add to it.
That's hard to add to. I think Gary articulated that very eloquently, and I think that we all are learning. And one of the things that always, my day job is running recruiting and retention for the U.S. Navy, and I also just wanted to add that our men and women in uniform are suffering 10 times worse than the general population. So I just wanted to add that, Professor, you bring up that it's a very valid point. I think stigma is something that we feel we can make a difference, and perhaps that's our origins.
I'm going to add one more data point to that. Just to back up what I said, 43%, in a recent survey, 43% of the public believes that people using prescription opioids, it's bad willpower. 43%. 80%, almost double, say that I'm not comfortable associating with someone as my friend, my coworker, or my neighbor, with someone who's using prescription opioids or addicted to prescription opioids. Double. So how do we change that? I think we need to change it by educating
appreciate the measured response and the content of that response. I want to thank you for that response. At some point, further conversations, not here, I'd really like to have that ongoing conversation about the scalability once we find things that work. Because I think that that's truly an important issue as well.
Just to add some color commentary to this, so part of the work that PGP, or Public Good Projects, does is we monitor media, we perform disease surveillance on publicly available types of media data. So this is Facebook and Twitter and Google data, other social media sites, as well as television, radio, and print, and just the internet as a whole. And I can tell you that, so we've been doing this for 2 years now. When you look at the data and you look at how people are talking about the opioid crisis and opioids in general, it is very different than those of us who worked in HIV, where there was a overwhelming public fear about HIV. No one knew how they got it. They wanted to be super far away from people who had it. Overwhelmingly, the framing of opioids in the United States is, I know someone who is suffering, and why aren't the people who are responding to this meeting me where I'm at in my community? It is not a conversation about fear. It's a rising anger at authorities for doing, in their perception, nothing, and then a just massive outpouring of grief and frustration. So we have an edge as responders in this room because it is touching everyone, and everyone wants there to be something done where they are. And that is very different than at least my experience in the HIV epidemic in the 80s. So, yeah.
I'm hearing a lot of local, and I know that the media is global, but I'm not hearing really some engagement of some of the global groups like the UN. So the UN is actually involved in this, and so is the World Health Organization. But they put together, just to use an example from another area, they put together a 10-year strategy called the Decade of Action for Road Safety. And they were able to engage a lot more private partners. That hasn't totally produced the results they were hoping for in terms of cutting road safety by 50%, road crashes and mortality by 50%, but they've been successful at leveling that off and in achieving some effectiveness in certain countries. But it really did call a lot of attention to it by raising it to a level where the UN brought together UN ministerials in Brazil and in Moscow and other places, and brought together the governments in those countries. So that might be one thing that you could look at in terms of doing a decade-long strategy. If you bring together a group that is accustomed to thinking in that length of time frame.
Great. Good point. Yes. Sarah.
Hi, this is Amy at Jeff. Jeff, WPP has a long history of using brilliant planners and data and account people and creative people to craft messaging and experiences to drive perception and behavior. You mentioned that you met with the governors. The governors have all of these communities that are on the receiving end, and very small, $125,000 a year, to the tune of about maybe $19 million nationally of money that they can do to create these experiences to support the communities that you're talking about, Joseph. Have you engaged with the governors about the drug-free community grants and how to help these people make more effective use of the money that they're receiving?
I think where we provide value in that scenario is giving. It's funny, talking to a number of the governors that they talk about being deer in the headlights, and they have programs, and my goodness, our teams are overwhelmed, and this is taking a big bite of our budget. More importantly, it's killing their constituencies and record numbers. So in talking to, we've already done 7 governors. We sort of talked to them and given them a free hour on the 850 radio stations locations. Literally, we've done it in Ohio, we've done it in Virginia, we've done it in Connecticut, and we've basically just providing them a voice. I mean, governors love to talk. Yeah, politicians do. So just when they have valuable airtime, a lot of them are using that hour in segmented times. But we do provide them with the sort of other assets, access to creative and media teams, behavioral scientists, anything that they wish. If this is just giving them tools and assets to help them get out their messages, and they're all different, frankly.
I mean, would that be an opportunity to partner with the folks at the White House and do something in a more coordinated fashion so that it's, rather than it being one-offs, it's something that's more coordinated and you can start leveraging each other's
Yeah, definitely.
positive experiences or successes?
Yeah, I think, we're definitely aware of some of the DFCs and HIDAs of getting the funds and actually executing them. And so we're definitely looking at opportunities to get them kind of some prepackaged messaging in a way that makes sense and is easier to get out.
It's the strategy piece. I think the piece that WPP really, I mean, if you're talking about things that they do really well, it's integrating the data and with how people behave and then actually, right, getting the messaging there. So I think a lot of like the work that we do with the drug-free communities, a lot of times you could be working with 5 communities, literally one next to the other, and they are all basically doing similar things ineffectively, and there's not I mean, the heart is completely in the right place, but there's not a strategy, and therefore you waste the little bit of funding that they do have. That's what I'm really talking about.
Very good point.
And then on
We will connect after.
Yeah. On the other end, I'm sure I'm not the only person who's been in this room where it's a state telling you, we don't know how we're going to spend the rest of SAMHSA money because we've done everything we can, and now we have to spend it just like sort of post 9/11 Homeland Security money. Just, I don't know. It all has to go out the door, and if we don't spend it, we're not going to get more next year. So we're going to have dog vests with long stones strapped to them. I don't know. Yeah, I think what I keep hearing is strategy, and woe to the organization who puts their strategy out first. But because I know we're all going to have a lot of opinions about it. But I hope that we see that come from you all, and it's been really great to hear that you're all willing to partner and work on that strategy. Any closing remarks for the group before we wrap?
I just want to sort of echo what the Surgeon General said this morning about better health through better partnerships. I think that says it all.
I'm going to go back to the question about scalability, I think, because it was interesting to me to hear about all the excitement around Take Back Day. Because to me, I've never really been a huge, not against Take Back Day at all, it's all great. But to me, let's get to the root of it, which is prescribing.
Yeah.
So we don't need Take Back Day.
Yeah.
But having said that, I listened to that, and what I thought about, and I married it with the question about scalability. What makes Take Back so exciting to people? It's an easy thing to do. You've given a call to action, and they can knock it out.
Yeah.
And they feel good that they contributed. And so if we can take that human behavior of give somebody a doable call to action, and maybe not redirect it, because keep that going, but add to it, which is what we're beginning to think about and what we're focused on right now. And I would encourage others to think about it as well. Of how do we create easy call to actions to create the partnerships that we all can create. We can all do this together.
Yeah, I think that's a great question as we go into Take Back Day, Recovery Month, Recovery Month in September.
October's next Take Back Day.
Right.
Yeah, and so, and I think, and the reason why, it's not only to support the people who are in recovery, to say, hey, like, we support you, but it also is it will do so much, it'll do so much to help destigmatize and to hit the stigma issue that we talked about.
Yeah, I think as someone who's new to the addiction field and still also being not an expert on the tech side, but having learned a lot about it, but having worked in a number of different social, economic, and health movements over the course of my career, I think we're in a really exciting place. It's a really hard and sad place because of the impact it's having on people, And I think, you know, having been in this for a limited amount of time, I think it's amazing how much change is happening so quickly. I think it's amazing that you have Twitter and Facebook up here, and I say that like actually in my personal capacity, not as a Facebook employee. I think it's like very exciting that you have the Googles, the Facebooks, the Twitters, and other companies in the world that are playing in this space. I think it's very exciting that the White House is leading on this and talking about this as a disease that is enormous, that it's not just one demographic of people. People have been struggling with addiction for all of time. And finally, we're showing the diversity of those spaces, and we're not making it a moral failing, but an actual public health issue, which is what it is. And that has happened quite quickly. I think people have responded and come together quite quickly. So I'm actually very encouraged. There's so much work to do, but there's always a lot of work to do, and these things don't change overnight, and you all know that as well, if not better than I. So I actually feel really excited about the opportunities here and about partners at this table and, you know, who are here and not even in the room. So I actually feel very encouraged.
Yeah. And to echo that, I think everyone in this room is incredibly smart and passionate about what they're doing. There's not one person in this space that is not incredibly passionate and dedicated to doing what they're doing. So thank you, all of you, for doing what you're doing, and I look forward to working with many of you in the future. And I have cards, and we'll open that after.
Lauren, did you want to make sure you had?
I skipped ahead of opera, so.
Okay. Well, I just wanted, if I could close just quickly by saying, all of the speakers you see in front of you are in extremely high demand. They could speak at 2 conferences every day, 7 days a week. But they all donated their time. They all are here for free, and they all traveled on their own to be with you all today. So if we could give them a round of applause. I think we can all use a restroom break.
Nice to meet you.
Thank you. We weren't in New York. That's why I was like, I'm so
I'm at
busy.